Hello, I am yours Keshavarao. As per the students and professionals request based, I am today talking about the duties and responsibilities of medical record officer and assistant medical record officer. Before going the topic, we will discuss organization flow chart of MRD staff. First is medical record officer, then assistant medical record officer, medical record technicians, junior medical record technicians, statistician, medical record clerks, data entry operators, and group D attenders. So now we are going to medical record officer duties and responsibilities. Medical record officer he will be the main head of the department of medical records like other department of the teaching hospitals. He should organize, develop, improve and manage the medical records department. He will be full in charge of the medical records of the discharged patients which are kept in the medical records department. He will have full control over the MRD staff that is working in the department. Internal postings from one section to another section, maintenance of attendance registers, maintenance of casual leave registers. He is authorized to issue the case sheets to the doctors, postgraduate students, medical students, and etc., but not outsiders. He should not issue the records outside of the department, that is, those who wish to study the case can sit in the department and make the notes. He is permitted to make direct contact, consult, and make correspondence with the higher officer of the concerned institutions about the matter that are the pertaining to the medical records department for its development and improvement. He is the authorized to sign the following documents for the medical superintendent and forward to the respective officers. They are death reports forwarding to the city corporation officers, cause of death formats to be forwarded to the chief register Bangalore, true copies of X-ray attestation, extract of portion of medical records for attestation, copies of wound certificate for attestation, police intimation regarding absconding patients along with case sheets etc., intimation of re-X-ray concerned police station, issue of corrigendum and letters to Honorable Court for handling over case sheets or registers etc. And he is authorized to sign the HM software monthly billings, and he is authorized to sign the forms control bills etc. He should give more attention towards the hospital statistics, and he should see that the hospital statistics are prepared well in time and make announcement on or before scheduled date of every month. Next, assistant medical record officer. He should supervise the following works in the medical records department: assembling and deficiency check, complete and incomplete record control, accession the discharge and death records and its entries, discharge and death analysis and its entries in the registers, supervising control over the forms and stationery, diagnostic coding and indexing the disease with the help of ICD books of WHO, restriction of medical records of all kind of OP and IP folders more than 10 years and above except the medical legal cases. He will be the in charge the medical records department in the absence of the medical record officer. He will have assist the medical record officer whenever needed for bona fide purpose. He should observe and see that all the records of MRD are intact. Next is Assistant Medical Record Officer for Statistics. He should collect the statistical figures from the outpatient and inpatient registers counter daily as follows. Total number of registration of male, female and children's, total number of repeaters, old renewing cases, registration of male, female and children, number of outpatients of paying and non-paying, green card, yellow card, below of the poverty level, geographical OP attendance, that is registration, it is to be made so that the strength of public who are coming from particular geographical area can be isolated to take preventive steps on the communicable diseases in the affected areas by the WHO. Age group wise, that is 5 to 10, 11 to 15, 15 to 20 and so on. Collect the total number of admissions cases from the OP counter registration counter in a sex wise, that is male, female and children. Service wise, like medicine, surgery, ortho, etc., in which number of admissions of male, female and children's and to work out. Average admission per day, number of patients discharged against medical advice, absconding with case records, number of without case records, average discharge per day, number of deaths of general cases and medical legal cases, in service wise, sex wise, deaths occurred below 48 hours and above 48 hours. Average death per day, total number of patients, bed occupied and beds vacant daily service unit wise and sex wise to each and very service units month wise and year wise. An average bed occupancy and bed vacant per day and also percentage in occupancy and vacant beds of the all services unit wise, etc. Number of major and minor surgeries daily, monthly and year in the service wise and unit wise. Average number of operations per day, number of investigations of different laboratories in the institution is to be collected, number of x-rays of different size is to be recorded daily, monthly, annually. Any other statistics entrusted by the medical record officer, then hand over to the compiled statistics to the computer operator for feed in the computer. This is the responsibilities of the medical record officer and assistant medical record officers. If you like this video, kindly subscribe and like. Thank you.